Understanding Type 2 Diabetes, a comprehensive guide. Type 2 diabetes is a chronic medical condition that has become increasingly prevalent in recent years. It's essential to have a comprehensive understanding of this disease, from its origins and classification, to the potentially dangerous consequences it can have on individuals' lives. In this in-depth guide, we will delve into the intricacies of Type 2 diabetes, shedding light on its origins, classification, and the real-life challenges faced by those living with this condition. Origins of Type 2 diabetes. Type 2 diabetes, often referred to as adult-onset diabetes, develops when the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. While the exact cause of this insulin resistance is multifaceted, several key factors contribute to its development. Genetic predisposition. Genetic factors play a significant role in the risk of developing Type 2 diabetes. Individuals with a family history of the condition are more susceptible. Lifestyle choices. Sedentary lifestyles, poor dietary choices, and obesity are primary risk factors. Excess body fat, especially around the abdomen, can contribute to insulin resistance. Metabolic syndrome. Conditions like high blood pressure, high triglyceride levels, and low HDL, good, cholesterol are often associated with Type 2 diabetes. Learn how to manage Type 2 diabetes. Enroll in our course. Classification of Type 2 diabetes. Type 2 diabetes can be further classified based on various factors. This classification helps medical professionals tailor treatment and management strategies for each patient's unique needs. Mild to moderate. Some individuals may have a milder form of Type 2 diabetes, which can often be managed effectively through lifestyle changes, such as dietary modifications and increased physical activity. Severe. In more severe cases, medication or insulin therapy may be necessary to regulate blood sugar levels. Complicated by other conditions. Type 2 diabetes is sometimes complicated by other health issues, such as cardiovascular disease or kidney problems. These cases require comprehensive management and monitoring. Dangerous consequences of Type 2 diabetes. Type 2 diabetes, if not properly managed, can lead to a range of serious health complications that significantly impact an individual's quality of life. Some of these dangerous consequences include cardiovascular complications. Individuals with Type 2 diabetes have a higher risk of heart disease, stroke, and peripheral vascular disease. Elevated blood sugar levels can damage blood vessels and increase the likelihood of these issues. Neuropathy. Nerve damage, known as neuropathy, is a common complication of diabetes. It can lead to pain, numbness, and tingling in the extremities, making daily activities challenging. Retinopathy. Diabetes can damage the blood vessels in the eyes, leading to diabetic retinopathy, a condition that can cause vision impairment and blindness if left untreated. Nephropathy. Diabetes is a leading cause of kidney disease. Over time, uncontrolled diabetes can lead to kidney damage, potentially requiring dialysis or transplantation. Amputation. Poorly managed diabetes can lead to poor circulation and nerve damage in the extremities, increasing the risk of infections and, in severe cases, amputation. Early warning signs and risk assessment. In addition to understanding the origins, classification, and dangerous consequences of Type 2 diabetes, it's crucial to be aware of the early warning signs and conduct a risk assessment. Frequent urination. An increased need to urinate, especially at night, may indicate high blood sugar levels. Excessive thirst. Persistent thirst, accompanied by increased fluid consumption, can be a sign of diabetes. Unexplained weight loss. Sudden weight loss without changes in diet or exercise may be a cause for concern. Fatigue. Feeling excessively tired, even after adequate rest, can be a symptom of diabetes. Blurred vision. Vision problems, such as blurred vision, may indicate changes in blood sugar levels. Slow healing wounds. Wounds that take longer to heal than usual can be a sign of poor blood sugar control. Family history. If you have a family history of diabetes, your risk may be higher, and regular screenings are advisable. Real-life case studies. Let's explore the experiences of individuals who have faced the challenges of Type 2 diabetes. Case study: Sarah's journey to diabetes control. Sarah L., a 35-year-old marketing executive, received a Type 2 diabetes diagnosis after years of neglecting her health. Her initial response was a wake-up call, and she embarked on a journey to regain control of her health. Sarah's diabetes management involved significant lifestyle changes, including adopting a balanced diet. and incorporating regular exercise into her routine. With the guidance of her healthcare team and the addition of medication, she successfully managed her condition. Today, Sarah enjoys renewed vitality and serves as an inspiration to others who may be facing similar challenges. Case study: David's struggle with complications.
David M., a 50-year-old construction worker, initially underestimated the seriousness of his diabetes diagnosis.
Unfortunately, his lack of adherence to treatment and lifestyle modifications led to severe complications over time. David's journey highlights the critical importance of early intervention and consistent management in type 2 diabetes care. His story serves as a poignant reminder of the potential consequences of neglecting the condition. Learn how to manage type 2 diabetes. Enroll in our course. Real-life success stories. In addition to case studies, we highlight individuals who have successfully managed type 2 diabetes. Success story: Lisa's diabetes reversal. Lisa P., a 50-year-old nurse, achieved diabetes remission through a carefully structured diet and exercise plan. Her remarkable journey showcases the potential for positive change and the possibility of reversing type 2 diabetes with the right strategies and support. Success story: James' journey to a medication-free life. James H., a 55-year-old accountant, reduced his reliance on diabetes medications by making sustainable lifestyle adjustments. His story demonstrates the power of long-term commitment to health and the potential for individuals with type 2 diabetes to achieve a medication-free life through lifestyle modifications. Frequently asked questions, FAQ. To provide comprehensive information, here are answers to frequently asked questions about type 2 diabetes. What are the primary risk factors for type 2 diabetes? The primary risk factors for type 2 diabetes include genetics, obesity, sedentary lifestyle, poor dietary choices, high blood pressure, and age. Having a family history of diabetes also increases the risk. How can I reduce my risk of developing type 2 diabetes? You can reduce your risk by maintaining a healthy weight through regular exercise and a balanced diet. Limiting sugar and refined carbohydrates, managing stress, and avoiding smoking are also essential. Regular checkups with your healthcare provider can help monitor your risk factors. What are the latest advancements in type 2 diabetes treatment? Recent advancements in type 2 diabetes treatment include the development of new medications that can help regulate blood sugar levels more effectively and with fewer side effects. Continuous glucose monitoring, CGM, and insulin pumps are also becoming more sophisticated, enhancing diabetes management. Are there any dietary recommendations for individuals with type 2 diabetes? A balanced diet for individuals with type 2 diabetes should focus on portion control, whole grains, lean proteins, and plenty of vegetables. Monitoring carbohydrate intake and choosing foods with a low glycemic index can help stabilize blood sugar levels. Consult with a registered dietitian for personalized guidance. What are the potential complications of uncontrolled type 2 diabetes? Uncontrolled type 2 diabetes can lead to various complications, including heart disease, stroke, kidney disease, neuropathy, nerve damage, retinopathy, vision problems, and an increased risk of infections. Proper management is crucial to reduce these risks. How can I monitor my blood sugar levels at home? You can monitor your blood sugar levels at home using a blood glucose meter. This device requires a small blood sample, typically obtained by pricking your finger, and provides immediate results. Your healthcare provider will guide you on when and how often to check your blood sugar. Is type 2 diabetes reversible? While it's not always possible to reverse type 2 diabetes completely, some individuals can achieve diabetes remission through significant lifestyle changes, such as weight loss, dietary improvements, and increased physical activity. However, this varies from person to person, and ongoing management is usually necessary. What is the role of physical activity in managing type 2 diabetes? Regular physical activity is crucial for managing type 2 diabetes. Exercise helps improve insulin sensitivity, lower blood sugar levels, and control weight. Aim for at least 150 minutes of moderate intensity exercise per week, as recommended by healthcare professionals. Can type 2 diabetes be managed without medication? In some cases, lifestyle changes alone can effectively manage type 2 diabetes. These changes may include dietary modifications, weight loss, and increased physical activity. However, medication or insulin therapy may be necessary for others, depending on the severity of the condition. Are there support groups or resources available for individuals living with type 2 diabetes? Yes, numerous support groups, online communities, and resources are available to individuals living with type 2 diabetes. These can provide emotional support, practical advice, and valuable information. Your healthcare provider can guide you to local and online resources to help you better manage your condition. Learn more about managing type 2 diabetes. To further enhance your understanding and management of type 2 diabetes, we invite you to explore our comprehensive course on this disease. This course provides valuable insights, practical tips, and expert guidance to help you take control of your health. Visit our course on managing type 2 diabetes to learn more. Conclusion. Type 2 diabetes is a complex and challenging condition that affects millions of individuals worldwide. Understanding its origins, classification, and the potential consequences it can have on one's health is crucial. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.